I've been using lasers to treat varicose veins for quite a long time. I first started using them in 2002 and I've done several thousand cases. But what we're using now here at Lewisham Hospital is a technique called Clarivein, which is one of the latest techniques to be developed in the United States. The main problem with using lasers to treat varicose veins is that it can be quite painful for the patient during the operation. And the reason for that is that you have to do multiple injections of anaesthetic into the leg. For that reason, we're trying to use a non-heat based method of closing the vein, which achieves the same results without using the heat that the laser does, which is very painful. The Clarivein works by having a small wire which protrudes at the end of a very thin catheter, which is the sheath that goes up the inside of the vein. We position the catheter in the right place at the top of the leg, and then the catheter is attached to a small handheld motor. When we pull the trigger of the motor starts the catheter spinning, and the wire at the end spins around very, very fast at around about 7,000 RPM. As we draw that rotating wire back down the leg, it becomes in contact with the inside lining of the vein, and it just scuffs it up and slightly damages the inside lining of the vein, so that when we then subsequently inject the drug, which comes out at the end of the catheter tip, it makes the vein close down. In medical terms, we call it occlusion, and the vein just becomes a sealed tube rather than a hollow one which is full of blood.
I had heard about the procedure on the internet. Obviously laser surgery and Clarivein being new procedures were much more beneficial, and also it means I had much less time off work, so it was much better for me. It was originally just the appearance, but as about 2 years ago, 18 months, it started to become much more painful. So being an active mum and working, it was hindering a lot of the things I could do.
Right. To date, we've been using this technique here since July 2010, and we've done approximately 60 cases so far, with some very good early results. Patients often ask me what happens when the vein that is leaking is blocked up. They have concerns about where does the blood flow. Well, fortunately, the saphenous vein, which is the vein that is most commonly implicated in varicose veins, is actually a pretty bit of a spare part in the leg. Most of the blood flow in the leg goes back up the deep veins, called the femoral vein, and very little blood actually goes through the saphenous vein. So you can do away with the saphenous vein with complete impunity, and it doesn't alter the blood flow to the leg in any way at all. As far as recovery time after Clarivein treatment is concerned, we've been amazed by how quickly patients get better. They have almost no pain afterwards. One or two of them may need to take paracetamol for a day or so, but there's virtually no pain afterwards and almost no bruising. So far it sounds absolutely marvellous, and indeed we're having a very good experience with it. The key question, of course, is how long will the treatment last for? And at the moment it's very early days. The largest follow-up series we have so far is from the United States, which is 12 months long in a group of 30 patients, all of whom seem to be successfully treated at 12 months. But of course it will take some time for us to generate the follow-up data on patients that we've treated to know whether it's going to last as long as the other treatments such as lasering for veins.
It was just as they said it was going to be. It didn't hurt at all. Didn't feel anything. It just felt like when you heard the drilling, it was like a razor, like a lady shave from years ago. It didn't have hardly any sensation. It was brilliant. Really, really, really good.
Today I'm seeing Nicola Dye in my clinic. It's now about 6 weeks since I operated on Nicola's right leg varicose veins using the new Clarivein technique. At this stage, what I'm really interested in finding out is how much pain she had after the operation, how much bruising, and what her symptoms are like after the operation as compared to before the operation. Hello there. Nice to see you again. Come and have a seat. Nice to see you.
Thank you.
Right, now it's about 6 weeks since your operation on the right leg. The first question I ask everybody at this stage is how much pain did you have after it?
I didn't actually have any pain.
Okay, none at all?
None at all.
The operation was entirely straightforward. It took about 15 minutes total time, which is about average for this procedure. She didn't have any pain at all during it, and at a 2-week follow-up scan, we've seen that the vein is now completely occluded, which is what we were expecting and hoping for. I'm fairly optimistic that she's going to get a good result and which will be durable.
There was a slight drilling noise, it's like being at the dentist. It was no more painful than that. It was just a case of the unexpected. It didn't hurt whatsoever. It lasted for about 20 minutes, and then after the procedure, I just got up as normal and walked out. That's completely come back to normal life. I don't have to. I literally go to work, come home, and it doesn't swell up anymore. It's just normal.
I'll see you again in due course.
Lovely.
Okay.
Thank you
All the
very
best
much.
now.
Nice to see you again.
Yeah.
Bye-bye.
Bye-bye.